Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very senior and respected professor, an expert in epidemiology from the US, but talking to us today from Zambia, Dr. Ramya Kumar. Ramya, welcome to the show.
Thank you so much. Thank you for having me. Just a small point of correction. I'm not a full professor yet. I am an
Okay.
assistant
Okay.
affiliate.
Okay, I stand corrected. Uh, Dr. Kumar is an affiliate assistant professor, Department of Epidemiology, University of Washington. She's a visiting scientist at the Center for Infectious Disease Research at Zambia, which is CIDRZ. Ramya is also a PhD uh, epidemiologist and a global health researcher whose work bridges public health science, communication, and systems equity. So, given the incredible amount of work that you've done, let me start by asking you, tell me a little bit about your own journey and what early experiences shaped your decision to work in epidemiology and global health.
Well, that's first of all, thank you so much for having me on the show, Ashutosh. This
Thank
is just a beautiful sentiment that you wanted to create a living memory of lots of people's expertise and lived experience. So that's a great sentiment to have for a
thank you.
podcast.
Thank you.
My journey in public health started at a very early age, actually. I grew up to a single mother
Hmm.
in Lowell, Massachusetts, which was a very low-income immigrant
Yeah.
community in America.
Hmm.
So you could see very clearly the structural disadvantages that you have
Hmm.
growing up in precarious economic situations,
Correct.
growing up to a single parent, growing up in a place where most of my peers didn't graduate high school, or many were involved in gangs or drugs. And you would see how this affected the health of a community.
Hmm.
So I very early on was interested in how politics and science and health came together
Hmm.
to create structural inequities that you
Hmm.
see.
Hmm.
And I studied at Boston University. I was a Dr. Martin Luther King Scholar. And
Wow.
I remember we invited Dr. Paul Farmer to come speak to us.
Hmm.
And his talks and ideas shaped this trajectory of social justice and equity,
Hmm.
even within science.
Right.
So I was accepted into the School of Medicine, actually, at Boston
Hmm.
University. I decided not to go. I was very much more interested in a public health, more population
Hmm.
impact rather
Hmm.
than individual patient care. So that was my path that led me into epidemiology and public health.
Wow.
And then I took a very winding path in through global health.
Hmm.
I I was after I graduated with a master's in public health, I was posted with CDC Zambia in Zambia. I was picked up by the ASPPH program at this time. It was the Association of Schools and Programs of Public Health,
Hmm.
and they put master students into different country offices within the CDC. So
Hmm.
that's how I found myself in
How
Zambia.
interesting. How interesting. Um, how has your identity as a feminist shaped your work in public health?
You know, feminism is really a school of thought. It's
Correct.
socio-political ideology, but it's also theory, it's
Absolutely.
praxis.
Hmm.
And at its core, its belief is that women deserve equal social,
Hmm.
political, economic rights.
Correct.
So feminism really gave me these analytical tools to
Hmm.
put words to the structural disadvantages that
Hmm.
we see every day.
Hmm.
And feminist scholars really helped us shape how we think about health systems as a whole. And I think
Yeah.
about Lisa Oleg and some of the work she's doing on intersectionality. That was the framework, that was the conceptual framework of my dissertation as a
Hmm.
PhD student. And intersectionality allows us to not just look at one axis of a problem like gender or race, but to look at intersecting identities and understand which groups will be most hurt by any kind of structural or policy decision. And really using these frameworks as praxis, as ways of redesigning systems so that they are putting the dignity of people first, especially those that are most marginalized.
Very interesting. If you look back at your journey, Ramya, what would you say has been your most transformative professional moment?
I that 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 professional moment was actually just a few months ago. It's
Okay.
been a whirlwind. It's been a whirlwind to work on a PhD in the last 4 years and think about feminist scholars and thought. Bell Hooks or Sylvia Tamale, thinking about uh, epistemic justice and whose voices matter. What kind of systems can we create if we're designing for people's dignity first? So it's been a long journey of reading and thinking and applying it in the field. And just this past December, I was called by WHO. I was invited as an expert for this closed door experts meeting where we spent a few days just thinking about
Oh,
futures
wonderful.
thinking and designing health systems looking into 2050. And a big part of what we discussed is kind of these dystopian future possibilities that are very real, as well as what are the more utopian possibilities that we'd like to see, and how might we backcast? How might we look at those utopian possibilities and backcast to what changes we need in the present to make our systems look more fair
Well
and just?
said. Well said. You have investigated outbreaks from cholera to bubonic plague. What does a day in the field actually look like for you?
Whew. Outbreak investigation.
Yeah,
Is there a typical or average day in the field? It can vary so much.
absolutely.
Part of what we did in
Mm,
Zambia was actually develop one of the first field epidemiology training programs. When
mhm,
I first came to the country, there was only two national epidemiologists
mhm,
for about 15 million people. So there was a serious need to train and build that capacity for more uh, field epidemiologists, especially.
mm,
So a big part of my training also was alongside my colleagues in Zambia who were very, very advanced or experienced health professionals. They were nurses, they were environmental officers, they were surveillance officers.
mm,
So I was learning alongside them
mhm,
as much as CDC was there to help build the institutional
mm,
capacity. Geez, days could be putting on gumboots during rainy season and walking through Kamwala area, which is one
mm,
of the more urban, densely populated
mm,
areas,
mm,
and investigating a cholera outbreak
mm,
and looking at where kids were pulling water from water points and how maybe during the rains that had broken some of the infrastructure around a water
mm,
point,
mm.
with latrines and water leaking into those points,
Yeah.
and me being on the ground investigating environmental
Mm,
problems. It could be days looking at data. It could be running a case control study at a local college
mm.
because they had a born outbreak
Yeah,
in the
yeah,
cafeteria.
yeah.
So you're looking now to interview people to minimize bias and to come up with associations for what food caused this outbreak.
Mm.
How soon can we implement a response measure so that we can get kids back to school?
Correct, correct, correct. You know, the world has just come out of this huge global epidemic of COVID. My question to you is, how does the common person actually understand more about the epidemic? And what are some of the unseen systems that people actually keep so that the responses for to an epidemic keep the whole system functioning?
Things about COVID is
Mm,
the amount of science communicators, science journalists, local community leaders that
mm,
became involved in reporting real time, not only the science, the epidemiology, the reproductive number, that's the
mm,
number we call for the number of people who'll be infected by a pathogen. They were also telling stories of how healthcare was delivered through
mm,
communities themselves, through community-based
mm,
organizations,
mm,
especially where state institutions failed.
mm, mm.
So I think they are still writing great pieces and
Mhm.
highlighting points of activism, even within scientific breakthroughs. The
Yeah.
HIV community is a great example of that.
Mm, mm.
So if the public wants to learn more, I would say check out your local science journalists, epidemiologists, and especially the community members themselves who are actively providing care, whether they're
Mm,
health workers or some NGOs that are working with groups. They're
mm,
a great resource.
mm. Because why I asked you this question was during COVID. I used to be on television very often, given my Gavi background, and I was amazed to find every single human being was an expert on the vaccine. Which was quite amazing. But let's keep moving on. Ramya, what do you believe are some of the most misunderstood aspects of global health today?
Well, could we go back to what you just said? So you said everybody was an expert on the
So I,
vaccine.
I used
Tell
to
me.
have I used to have politicians who would read something or get something from WhatsApp University and come and pontificate about it on television, and that was the biggest rumor mongering. And I used to call them out on something like this. But I want to move away from that because this is your podcast. Uh, my next question for you is: what do you believe are some of the most misunderstood aspects of global health today?
I gave a TED talk recently
Hmm.
where a very simple question. I asked people who gets to be the expert.
Hmm.
And too often, intellectuals don't have a lot of structural humility around what we know and what we don't know, as well as who gets to be a knower.
Hmm.
Right?
Yeah.
Who gets to be the expert? So when you
Correct.
said to me, everybody on TV was an expert, well,
Yeah.
in a way, everybody does have a unique lived experience of
Hmm.
what it was to go through a pandemic or
Hmm.
what response measures for outbreaks really mean. How do they impact certain people? When
Correct.
you close
Correct.
bars and small businesses,
Hmm.
how does that affect people's livelihoods? How does this
Correct.
affect
Very well said. In fact, one of the things that I often used to ask was that why is it that we don't have more epidemiologists and scientists coming and speaking? Because they're the only people who know what the actual position is. And therefore, I wanted to ask you, how can experts like you speak to the public without oversimplifying the problem? Whenever there is a challenge faced in global public health, as we saw during the COVID, there was a big gap that was seen between knowledge that was available with the common person who was getting impacted. My question is, how can experts on the subject, which are really epidemiologists and scientists, communicate directly with people without oversimplifying a matter?
I'm not sure that I agree that scientists and epidemiologists are the only experts or the real experts.
Yeah.
We are experts. We do bring expertise. We
Hmm.
have a structured way of thinking about outbreaks
Hmm.
or systems. Yes, we definitely have that.
Hmm.
But I also do believe that simplifying findings and making things easy to understand is not dumbing things down.
Sure.
It's meeting people where they are.
Correct.
It's learning how to communicate your findings to the real world in real world settings
Mm.
by the end users. So
Mm.
ultimately, if we're asking why are we doing all of this, it's to be able to be in conversation
Correct.
with people
Correct.
rather than a one-way top-down approach of
Sure.
sharing what
Sure.
we think.
Yeah, you're absolutely right. You're absolutely right. Uh, I've got a few more questions to ask you. Uh, where do you see the biggest gaps in equity within global health?
What are
No,
the
we can
biggest?
skip that because what I have seen also, and I'm happy to uh, get your input on this, is that global health has huge gaps. I mean, there are parts of India, there are parts of Asia have a lot of global health facilities available, and yet within the same country, there aren't enough. The same thing applies to developing parts of Africa as well. So I just thought I'd get your perspective. Do you see any gaps in equity for people when it comes to global health? Because you worked in several countries.
Well, I'll tell you what I'm working on right now, which
Yeah.
is my work is with sex workers as
Hmm.
well as other what we call key populations in the
Hmm.
HIV world. These
Hmm.
are groups of people, subpopulations that are very susceptible to acquiring HIV.
Hmm.
So this could be people who inject drugs, uh, LGBTQ individuals. And so, with the changes in global health funding,
Hmm.
we are seeing a shift and a definite reduction
Hmm.
in funding and spaces
Hmm.
for key populations. And we know that for many of these groups, care at public facilities is very difficult to sustain because
Hmm.
of the level of discrimination that they
Hmm.
face as
Hmm.
well as their unique needs in accessing
Right.
care.
Hmm.
So, this is something I think a lot about because I work in it every
Hmm.
day.
Hmm.
I see that need to continue to fund spaces for key populations. And India is a fantastic example
Correct.
of work activists.
Hmm.
There was a great Guardian article that came out 7 years
Hmm.
ago. It was called The Untold Story
Hmm.
of how India sex workers prevented
Hmm.
an, an AIDS outbreak.
Hmm.
And it highlighted how in the red light district in Calcutta or in Mumbai, sex workers were really delivering their own prevention and care
Correct.
in their
Correct.
own spaces. And we never do a good job of documenting how many infections were averted, but going beyond those measures of like infections averted, how how much how much dignity and safety and quality of care did
Hmm.
women experience through that?
Yeah. 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 Well said. I have time for two more questions for you. Um, how can countries design health systems that genuinely put people first rather than institutions first?
I go back often to a lot of the work that I've done with the
Yeah.
sex work community.
Hmm.
And
Absolutely.
I think about how we focus on designing systems
Hmm.
that care about a person's dignity
Hmm.
versus the need to control them. So a system that is controlling is focusing on surveillance, not in the way you and I use the word disease surveillance, which
Hmm.
is during the patterns and
Yeah.
trends of disease over time, but an intrusive surveillance that seeks to control and punish people for their
Hmm.
behavior, rather than a dignity system that would prioritize care and trust and structural accountability. Uh, Again, those are things that feminist scholars like Bell Hooks
Hmm.
have really feminism to be about liberation and care.
Mm-hmm.
You know, Ashutosh, there were these headlines, do you remember during pandemic that would say COVID missed Africa? You know, people didn't die in Africa.
Yeah.
And so the outcome is this artificial binary of 0 or 1.
Correct.
You either died or you're alive. And even thinking about systems that go beyond just measuring 0, 1, death or alive. How well did you die? How well are you living? There are so many ways that
Absolutely.
it's baked even with outcomes.
Absolutely. And my last question for you, Ramya, given the fact that you've chosen to make a life and a career in public health and global systems for health, what gives you hope for the future of public health?
This question is easy, and it's easy for me because even though we're in a very dark period, we are seeing expanded surveillance. We are seeing more and more authoritarianism and control, as well as a very frightening normalization of the violation of people's human rights. We're seeing it all across the globe. And we're coming out of, well, we're not really coming out of, we are still living through overlapping crises, pandemic, climate change, as well as economic precarity, right? Everything costs more, and nothing is easy economically worldwide, right? But I also see a lot of hope in a hyper-connected generation.
Correct.
That information is so widely accessible. And you see on TikTok and Instagram, people are talking about feminist theory, talking about decolonial theory. They're making visible every day the structures that oppress us and remain invisibilized, right? That gives me a lot of hope because every generation has to rediscover for themselves the power of solidarity.
Correct. And you're so right. But on that note, I just want to add one thought that I had, which is that, you know, I'm from the boomers generation, you know, and we were in a situation where there's very little that we could communicate because there wasn't enough of an avenue or opportunities. We had to listen and read what others felt. But in today's world, younger people like you are able to express their views because of social media. And that is going global, and therefore perspectives from all over the world are now coming in when it comes to issues and matters of public health. But on that note also, Ramya, I just want to say thank you so much for speaking to me. This has been such a fascinating conversation. Your perspectives are very interesting. I hope my questions were not too surprising for you, but I think you did manage to handle all the difficult ones that I did ask you also. Thank you so much for speaking to me, and good luck to you.
So much. Thank you for having me.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for The Brand Called You.